Hi, welcome to Infomed's Medicla channel. Today we will discuss alprazolam, uses of alprazolam, side effects of alprazolam, and also contraindications of alprazolam. And in the end, we will tell where alprazolam can be used in pregnancy or during breastfeeding or not. So let's start this informative video. Alprazolam is an antidepressant drug. It belongs to a class of medications called benzodiazepines, which act on the brain and nerves, central nervous system, to produce a calming effect. What are the uses of alprazolam? Alprazolam is used to treat anxiety disorders. It is also used for panic disorders and anxiety caused by depression. What are the side effects of alprazolam? By using the alprazolam table, a patient may develop some side effects. So tell your doctor if any of these symptoms are severe or do not go away. Drowsiness, lightheadedness, headache, tiredness, dizziness, increased saliva production, difficulty concentrating. What are the dosages of alprazolam tablet? For anxiety, 0.25 to 0.5 mg per 8 hours, not to exceed 4 mg per day. For panic disorder, immediate release, 0.5 mg per 8 hours, not exceed 1 mg per day. Extended release tablets. Initial dose, 0.5 to 1 mg orally once a day. Maintenance dose, 3 to 6 mg orally per day, preferably in the morning. Maximum dose, 10 mg per day. Contraindications of alprazolam. Do not use alprazolam if you have hypersensitivity to benzodiazepines, psychoses, acute narrow-angle glaucoma, shock and coma, acute alcoholic intoxication with depression of vital signs, during pregnancy, crosses the placenta, risk of congenital malformations, labor and during delivery. What are the precautions and warnings of alprazolam? Don't use alprazolam during pregnancy. You should consult your doctor before starting this medicine. Alprazolam may pass into breast milk, so alprazolam tablet should not be used while breastfeeding. Belle, did you enjoy the video? If yes, thumbs up, hit the like button below and comment if you liked. Red circle, turn on notifications so you don't miss my next videos.